If you have anxiety and you'd like to know what's actually going on in an anxious brain and what are some of the effective treatment solutions, that's what this video is about. We're going to look at the neurotransmitters, the brain structures, the amygdala, the hippocampus, the default mode network, the ACC. We're going to look at adjunctive treatment therapies, all added together. They're quite useful. And then the type of psychotherapies. At the end of the video, I'm going to tell you about a really exciting, brand new way of doing exposure therapy. Anxiety disorders really suck, and the currently available treatments are not that great. I've been trying to develop better treatment solutions for anxiety for over 15 years. And in this video, I'm going to share what I've come up with so far. Years ago, it became really clear to me, trying to overcome anxiety by targeting and changing neurotransmitter levels doesn't work for everybody, or it's only a partial success for a lot of people. I'll start with mentioning the neurotransmitters, but then I want to take you in a different direction that focus on the structures and anatomy in the anxious brain rather than just the neurotransmitters in the synapses. And at the end of the video, I'm going to tell you about a really exciting new way of overcoming anxiety. I genuinely believe it's a game changer. I've been practicing general functional medicine since 1988. That's over 35 years now. And in the last 15 years, I've specialized exclusively in brain and mental health conditions. And this new thing, this new treatment technique I'm going to share at the end of the video, is one of those revolutionary new developments that only come along once every few years or even decades. Let's start by taking a look at trying to overcome anxiety by treating neurotransmitters. Upregulating serotonin with antidepressants, SSRIs, reduces symptoms in about 50% of patients, but only about 30% of people experience full remission, such that they would no longer be diagnosed with anxiety. Put the other way, 70% of patients don't experience full remission from SSRIs. Then there's the benzodiazepines that target GABA. These can reduce symptoms in about 70% of patients initially, but they can stop working over time, produce dependency, and some people experience horrific withdrawal conditions that can last for years. All the facts and figures I'm giving you, you can easily look up for yourself online. Please check my numbers. In my practice, I also tried boosting serotonin and GABA with herbs and natural supplements, and at best it would produce a temporary or small relief of symptoms, but never a total cure. So as I said, about 15 years ago, I set out to find better solutions. And it led me away from the neurotransmitters into looking at the structures and circuits in the brain that are involved in anxiety and how we can change those things, those structures and circuits. Now, I'm not making up any false claims that I've got some miracle cure for anxiety here. I'm just a practitioner trying to do my best to improve outcomes. I'm just telling you about the techniques I've been developing to enhance the effectiveness of existing treatments and giving my patients a better chance of overcoming or at least minimizing this very, very painful and distressing condition and leading a better life. Just because I said targeting neurotransmitters with supplements is not that effective doesn't mean to say that you couldn't use them temporarily as something to reduce your symptoms, like putting a band-aid on something, while you then engage in the other more effective treatments that have longer lasting and more beneficial effects. So the supplements that you would use to boost GABA include theanine, passion flower, ashwagandha, taurine, magnolia bark. The supplements you would use to increase serotonin include 5-HTP, saffron, zembrin, but a really important thing to do if you're going to fix serotonin metabolism is to decrease inflammation. Inflammation left in the brain interferes with serotonin production. And I should have said before, lithium orotate for GABA, lithium orotate also for serotonin. At this point, let me just jump over to another routinely prescribed treatment for anxiety, which is cognitive behavioral therapy. Studies have shown that CBT can produce full remission in 40 to 60% of people. So that's about half, which is great if you're in the successful half. But it's basically 50-50, a coin toss. So what else can you do to enhance your chances of either fully overcoming anxiety, or even if you don't fully overcome it, at least reducing your anxiety condition to the absolute minimum possible? I believe the answer is yes, and it involves remodeling the structures and circuits that connect the structures in the anxious brain that are involved in creating the disorder. A quick disclaimer here, don't stop taking any medication that you need to keep you safe. Consult with a suitably qualified practitioner if you intend to make any changes to your prescription. This is a health educational video and not a medical consultation. Let's get into the brain structures in more detail. So if anxiety is not an imbalance in neurotransmitters, then what is it? The new understanding is that mental health conditions, especially anxiety, involve imbalances in the size and shape of specific structures in the brain involved in detecting threat and anxiety, and also the amount of wiring or connections between those structures. As a result of these differences, the anxious brain is hardwired to be hypervigilant about threat and danger, to perceive or even make up threat and danger when in reality the threat and danger are not significant. The problem is that the frontal conscious parts of our brain can't tell the difference between real danger and the distorted perception of danger in anxiety. As far as our thinking brain is concerned, the danger is totally real. It's difficult for people that don't have anxiety to understand what we go through. I ask them to imagine the level of stress and fear they would experience if they were a soldier in a battle running across open ground against machine gun fire. I explain that when a person is experiencing anxiety, they are having the same level of stress response as you would in a battle, but whilst doing something that may seem perfectly benign and safe to others. Anxiety is not logical or rational, and you cannot just talk yourself out of it. The structures that cause anxiety are subconscious systems in the brain. They're not part of the conscious system. Brain scans of people with anxiety have consistently shown hyperactivity in a structure of the brain called the amygdala. The amygdala is kind of like a burglar alarm. It's scanning the environment and looking for potential threats. An important feature of the amygdala is that it receives information from our senses about the situation we are in a few milliseconds before the information from our senses is sent to the thinking frontal part of the brain. And in those few milliseconds, if the amygdala detects a match between the situation we are in and a situation it has been programmed to believe is dangerous, it will activate a fear and flight or fight response before our thinking brain even knows where we are. Even if you did try to tell yourself there's nothing to be worried about, by the time your thinking brain recognizes the situation and that you are having a fear response, it's already too late. The anxiety response has already been triggered. This means that you cannot get in front of the anxiety response in the amygdala and stop it before it's triggered. Furthermore, the strength of the connections running from the amygdala up to the frontal lobes is stronger than the connections running the other way from the frontal lobes down to the amygdala. So even after the anxiety response has been triggered, or in the middle of an anxiety response, you cannot use your frontal thinking brain to say to the amygdala, look, I've risk assessed the situation and I think we're okay. There's nothing to be afraid of. If the amygdala decides that there is something to be afraid of, it's going to win in an argument against the frontal thinking lobes. So what can we do when we have a hyperactive or hyperreactive amygdala triggering stress and anxiety responses when we're not really in danger and we don't need or want them? Well, I'm going to tell you about 3 things that you can do to dial down unwanted stress responses from your amygdala that I've found so far. The first is a combination of lithium orotate and Zembrin. Both of these have been shown to dial down the reactivity of the amygdala. A second thing that dials down the reactivity of the amygdala is 50 hours at least of meditation. Brain scans have shown just as little as 50 hours of meditation can be effective, but I put 50 to 150 because really to overcome anxiety, you really want to strongly dial down the reactivity of the amygdala. The third thing is something called exposure therapy. Now I'm going to talk more about that at the end because there's a new advanced way of doing exposure therapy. It's when you expose the amygdala to something it's afraid of, but teach it that it doesn't have to be afraid of that thing. I'm going to add in 2 extra things here. I said 3, but I'm going to add in an extra 2. The additional things that you can use to dial down reactivity in the amygdala are psilocybin therapy, and I do mean therapy, I don't just mean tripping on mushrooms, but this is not something I have clinical experience with. Although the studies are looking really exciting and interesting, and it looks like it has a effective and long-lasting effect. And then the other one is you could use the same supplements that I mentioned before to boost GABA, taurine plus theanine, passionflower, ashwagandha, magnolia bark, etc. Although these are only going to really have temporary effects. The main things to do are change the structure of the amygdala by doing a lot of meditation brain training exercise, combined with lithium and Zembrin, and then moving on to exposure therapy. Both lithium and Zembrin have been shown to remodel the way the amygdala functions and change its interconnectivity, the connections it makes to the rest of the brain in a way that basically dials down its reactivity. If you're finding this information helpful, can I ask you to give me a thumbs up so that this information can get out to more people who may also benefit from it? And if you don't want to miss my future videos, subscribe and don't forget to click the notifications bell. Oh, something I should correct. I've made a bunch of videos about lithium orotate. Some of them were made a few years ago. And at that time, I said that lithium orotate was not particularly effective for anxiety. Since then, I listened to people's comments and I responded by using it more with my anxiety patients. And today, I actually highly recommend it for anxiety. So ignore what I said 5 years ago about lithium and anxiety. If you're really serious about overcoming anxiety, do include the meditation brain training exercises in your treatment program. Meditation produces effects or changes in the brain that no other treatment can do. Scans have shown changes in the amygdala with as little as 50 hours of meditation spread over 3 months. So we're talking about doing 30 minutes a day for 100 days. And it's really important to understand something. Not all meditations produce the same effects, and you need to choose the right meditation. More on that later. I'm going to circle back to exposure therapy at the end of the video. But for those of you who don't know what it is, the amygdala only learns by experience. You can't tell it that something is safe, and it doesn't need to respond with a danger signal. You have to literally show it that something is safe. It turns out exposure therapy is highly effective, but most people with anxiety fear doing it. They don't want to do it. That's why I recommend pushing it down the road and beginning with these other practices, the meditations, the Zembrin, the lithium, maybe psilocybin, I don't know, and other things, so that you start by dialing down the reactivity of the amygdala. It makes it easier and less scary to do the exposure therapy later on. There are 2 more brain structures that you should work on if you have an anxiety disorder. There's a structure called the hippocampus, which is here. You see it's connected to the amygdala. More about that later. The hippocampus stores memories, including traumatic memories and the feelings associated with traumatic memories. The hippocampus will even store memories of past anxiety attacks that could then escalate and intensify the current panic attack you're having. Now, if you're aware of carrying traumatic memories, if you know you had a traumatic past, and you have an anxiety disorder or depression, I highly recommend that you do some kind of trauma release therapy. And specifically for the hippocampus, you want to do that kind of trauma release therapy that involves going backwards in time, bringing up memories from the past. Things like timeline therapy, which is used in NLP. When it comes to combating anxiety, the only really useful supplement we can use to work on the hippocampus is lithium orotate. It changes the internal structure and the wiring connections from the hippocampus to the other parts of the brain. You could also take taurine, the amino acid taurine. It accumulates in the hippocampus and stimulates the growth of new cells and can have a temporary anti-anxiety effect. As I mentioned, additional treatments are regression trauma therapy and the new exciting way of doing exposure therapy, which I'm going to discuss later. In a minute, I'm going to explain to you how the amygdala consults with the hippocampus to create a package of information, scary and worrying information, that then gets relayed forward to the thinking parts of the brain, the frontal cortex. This network is called the default mode network, and overactivity in the default mode network is a central feature of anxiety disorders. But before discussing that circuit, I want to introduce you to the anterior cingulate cortex, this structure here. The ACC is another key player in anxiety disorders. The ACC is involved in emotional processing. It's involved in assessing the situation we're in and social anxiety, other types of anxiety as well. Very much involved in depression. It's involved in impulse control and willpower and therefore addiction. It's a really fascinating structure. A simple Google search of anterior cingulate cortex plus sign anxiety will give you a lot of information to research. Brain scans have consistently shown altered function of the ACC and altered interconnectedness from the ACC to other parts of the brain in people with anxiety disorders. It could be that one of the main reasons why meditation combats anxiety is because it changes the structure and interconnectedness of the ACC. So here are 3 techniques I know of to change the function of the ACC to combat anxiety. Actually, correction, there are 4 things. I said 3 before. Now, the first 2 are lithium orotate and intense focused meditation. Maybe the regular style of mindfulness that people do works, which is less intense focus. But in my practice, I utilize a particularly hard focus style of meditation, which I call the TPN meditation. That name will make sense in a minute, which is specifically designed to give the ACC a hard workout to stimulate the maximum change. The third treatment strategy you can use to change the ACC is brand new and a little bit strange. So it turns out when we make ourselves do things that we don't want to do, things we don't like doing, it has a positive therapeutic effect on the ACC. So for example, if you don't like taking cold showers and you make yourself take cold showers, you not only get the benefits of the cold showers, but you will also stimulate growth and change in your ACC. If you do like taking cold showers, you just get the benefits of the cold showers, but you don't get the brain stimulation which changes the ACC. There's something about making ourselves do things that we don't want to do, that are a little uncomfortable, that require willpower and discipline to force ourselves to do them. I think it kind of sucks. Why couldn't it be that we get a therapeutic effect on the ACC when we do things that we like doing? The ACC is involved in creating the psychological qualities of willpower and determination, and it's probably something to do with that means that we benefit when we do something we don't want to do. Now, obviously, you should choose to do things that stimulate your ACC that are inherently healthy. Cold showers, I just mentioned. It could be doing exercise if you don't like it, eating green vegetables, cleaning your house or your room, doing the meditations if you don't like doing the meditations. Another quality the ACC gives us is the ability to maintain our focus on our tasks. If you've got an hour's worth of emails to do, and you stay on point, it's the ACC that enables you to do that. If every few minutes you get sidetracked into something else, perhaps you have ADHD, then you have an under-functioning ACC. Now, when you meditate, a central feature of meditation is maintaining and holding your focus. Of course, the mind wanders off. The ACC should inform you that you've wandered off, that you notice that you've lost your focus, and then bring you back on point. Every time you do that, it's not actually a failure in meditation, it's a success. Because the act of paying attention to what you're doing, noticing when you've wandered off track, and bringing yourself back, gives the ACC a workout. Okay, so far we've looked at individual structures. Now let's see how they connect together and fit into the circuits in the brain involved in anxiety. When triggered, the amygdala creates scary and pleasant feelings. It then checks in the hippocampus to see if the hippocampus has got any memories associated with these feelings. And unfortunately, the hippocampus will likely oblige and has lots of memories of past anxious experiences. So it then adds distressing, scary, negative memories and experiences to the feelings from the amygdala. This is all passed up to a processing center in the back of the brain and then relayed forward into the frontal thinking part of the brain where we are conscious, creating distressing and anxious thoughts and feelings. Now, when this network, which is called the default mode network, is hyperactive, it means that the thinking conscious part of our brain is being persistently bombarded by distressing, anxious thoughts and feelings. Scans have consistently shown that the default mode network is hyperactive in people with anxiety, depression, and bipolar disorder. So the amygdala and hippocampus are part of this default mode network. Where the ACC fits in is it's a dominating structure in an alternative network that switches off the default mode network. So how do we dial down and compensate for the hyperactivity in our default mode network? There are 3 treatment options that I know of to work on the default mode network. One is lithium orotate, focused meditation, and psilocybin therapy have been consistently mentioned when it comes to improving the function of the ACC, the default mode network, and the amygdala. Well, that's not going to be a coincidence. Things that dampen down overactivity in the amygdala and hippocampus are going to dial down activity in the default mode network. And things that strengthen the anterior cingulate cortex are going to strengthen an opposing network, which I'll tell you about right now, called the task positive network, or TPN. I hope that makes sense. It was a little complicated. I'm saying that lithium and focused meditation all work on what look like separate structures, but that's because they are not separate structures. They're tied together in a network or 2 opposing networks. Let me see if I can explain and simplify that. So we have these two networks in the brain. One is the default mode network and the other is the task positive network. Now in a healthy brain, there will be a real flow and ebb between those two networks. You're never active in both at the same time. When one becomes active and switches on, the other is deactivated, and vice versa. In anxious and depressed brains, however, there's less flow and ebb between the two, and the default mode network remains stuck on, spinning its wheels. It's dominating this balance. You can imagine that if you've got a hyperreactive amygdala, it's at the first point in the default mode network, and it's going to keep reactivating that circuit. And then if you've also got a lot of negative memory stored in your hippocampus, there's just so much information flowing from the amygdala and hippocampus through this default mode network, unfortunately then bombarding your frontal thinking brain with either depressed feelings and thoughts or anxious feelings and thoughts. Studies have shown that meditation in general helps to balance activity between the DMN and TPN, but I thought about how I might be able to enhance the effectiveness. When I understood that activating the TPN was the goal, because it switches off the DMN and rumination in the DMN, what I did was string together several focused mindfulness meditation techniques that specifically activate the structures of the TPN. It's actually quite difficult to draw on a diagram all the structures of the TPN because they're actually deep and buried. Here we see the ACC, lateral frontal cortex, somatosensory cortex, and the thalamus. The thalamus really acts as a bridge or switch between the task positive network and the default mode network. It's also possible that by practicing a TPN meditation, a task positive focused meditation, we improve the brain's ability to switch between the two networks. It's only since about 2017 that we've had enough scans to identify which parts of the brain are activated by specific meditation techniques. I would love to have a huge budget so I could do controlled clinical trials on the techniques I use in my practice. But I don't. This is all experimental and hypothetical. I'm just trying my best to think about how we can optimize the efficiency and effectiveness of the available treatment options for anxiety. I myself have done a lot of different types of meditation, and I've also worked with people who've done a lot of different types of meditation. And the feedback is that this specific meditation, what I call the TPM meditation sequence, does feel quite different. It can very quickly put your mind into a different state. It is distinctly different from the style of mindfulness that has gone all around the world, where you sit in a passive or neutral state of mind and are supposed to just allow any thoughts and feelings to pass through your mind and just observe them and let them go. I always thought that was a ridiculous suggestion for people with depression and anxiety, and definitely don't do that if you have schizophrenia. If you open your mind to allow anxious thoughts and feelings to come into your awareness during meditation, they will likely just take over and hijack the session. Instead of doing a meditation, you're having a panic attack. In the TPN meditation, however, you do not open your mind up in a passive and neutral way. In regular mindfulness, they say, don't force anything or deliberately concentrate on anything. In the TPN meditation, you absolutely force yourself to deliberately concentrate, which is exercising the ACC, on your different senses, one at a time, and then multitasking them together. We are so preoccupied and busying ourselves with doing the actual meditation that this temporarily denies our anxious thoughts and feelings access to our mind. I actually highly recommend that you do the open monitoring classical mindfulness at some point in the future. I just don't recommend it's the right meditation to start with. Now, I'm planning on putting the TPN meditation into a course that you could purchase online, but I haven't done that yet. In the meantime, the only way to learn the techniques that I use is by booking a one-to-one session with me. I'll give you details on how to do that and the other things that you would get in a one-to-one session later on. Okay, so that's all I'm going to say about the structures and circuits involved in anxiety and meditation techniques. I hope you found that useful, and I really urge you to put that information into action. Whether you use my meditation techniques or some other technique, you can really move yourself forward in your goal to overcome anxiety by doing self-directed neuroplastic remodeling of those circuits and structures. Good luck with it. I'd love to hear in the comments how you get on, or if you've done meditation and how it's worked for you and so forth. Now, there's a little list of additional what you would call adjunctive things with anti-anxiety effects that you should also take advantage of. Additional or adjunctive treatments you can use with anti-anxiety effects include building up a healthy colony of gut bacteria, and there are some specific strains of bacteria that we want to seed into the intestines that have GABA and serotonin producing effects which have anti-anxiety effects. To grow and develop a healthy gut bacteria, we should eat a diet very high in fiber to feed the bacteria, and polyphenols also feed the bacteria. Another anti-anxiety thing we can do, I'll explain it in a minute, are kindness or acts of kindness. There's a technique a lot of people like called the 3-3-3 technique. And finally, the Buteyko breathing technique. There are some specific species of probiotic bacteria that we want to introduce into our gut and then feed and grow them. There's Lactobacillus reuteri and rhamnosus that produce GABA, and then there's Helvetius 52 and Longum 175. If you take probiotics and you're not eating enough fiber and polyphenols to feed them, you're kind of wasting your money. But, if you're starting from a very unhealthy condition in your intestines and a low fiber diet, and you suddenly start eating a lot of fiber, you might actually temporarily increase inflammation in your body and aggravate your condition. You need to increase fiber slowly. I know everybody's got the YouTube and everybody thinks they're a nutritional expert today, but I really recommend you work with a nutritional consultant. If you wanted, you could work with me. My first training was in nutrition. I spent years specializing just in digestive problems. I had irritable bowel syndrome myself, haven't seen that since the early 90s. That was before I changed my practice over to specializing just in brain and mental health conditions. It's worth noting that a diet high in polyphenols has a powerful anti-inflammatory and anti-anxiety effect in its own right. The effect size might be quite small, but every little helps. Another proven technique for reducing anxiety is to perform acts of kindness, random acts of kindness. Look it up online. It's super cool. What you do is you help someone else out to help combat your own anxiety. It's a win-win. There's also a meditation technique which is called the loving kindness meditation, which stimulates the parts of the brain involved in that quality of loving kindness and generosity. It's another meditation technique I use in my practice in addition to the TPN meditation. There's a simple anti-anxiety technique called the 3-3-3 technique. I'm not going to explain it, look it up online. A lot of people get benefits from it. It might actually work because it might bring you out of default mode network and into the present moment and the TPN state. It's worth giving it a try. And then the last adjunctive technique is something called the Buteyko breathing method. This is especially effective for people who suffer from panic disorders. If you've ever noticed that when you've taken deep breaths, maybe you were given the advice to take deep breaths, it didn't actually calm you down, but in fact increased your feelings of anxiety, then the Buteyko breathing technique could be a game changer for you. So it turns out that some people with anxiety disorders have brains that are particularly sensitive to carbon dioxide levels. And if they habitually breathe in a way that expels too much carbon dioxide, a kind of over-breathing, it can induce panic attacks. It would take up too much time to explain the mechanism, but basically the brain goes into crisis mode. It ramps up our heartbeat and blood pressure. It feels like you're having a heart attack. You discharge adrenaline, feel faint and dizzy, and all kinds of other symptoms. When someone's having a panic attack, the reason that breathing into a bag is the antidote is because when you breathe into a bag, you recycle your carbon dioxide and build the levels back up quickly. The technique was developed by a Russian professor called Dr. Buteyko that, funnily enough, came to work in the same clinic that I worked in London. It trains you to go in the opposite direction to deep breathing. You actually take shallow breaths, diminutive breaths. You stop over-breathing, expelling too much carbon dioxide, which can trigger panic. Now, all of the techniques I've discussed so far, the supplements, lithium, Zembrin, the meditation brain training exercises, the adjunctive therapies, are just phase one of the treatment. The goal is to reshape your brain so that your anxiety is diminished before moving on to the next phase. You should be seeing good results within 3 months, but you actually want to carry on for at least 6 months and ideally 9, doing, say, TPN meditation, then the loving kindness meditation, and then another type of meditation, perhaps the TPN again. I know that sounds like a long time and a lot of work, but what else are you going to be doing? I believe it's totally possible to treat even quite severe mental health conditions using natural self-help therapies, or at least significantly improve the condition. using these techniques, I put my bipolar disorder into remission. I still have it, it's still there. And I've basically fully overcome my anxiety disorder. If it helps to motivate you, there's nothing stopping you from looking online every day for some quick fix magic cure, whilst in the meantime chugging away with the slow techniques over many months, and then see which approach gets you to where you want to be first. Now, after you've completed phase 1, your anxiety should be diminished. You'll still have anxiety. Remember, I've never seen anybody totally cure themselves with meditation brain training techniques alone, or with supplements. But I have seen people diminish the anxiety. Now you're ready to move on to phase 2, which is doing cognitive behavioral therapy, or CBT. Now, before you dismiss that and click off and leave the video, I know a lot of you don't like CBT and don't rate it very highly, but as a standalone therapy, CBT is capable of producing remission in 40 to 60% of patients, or an average of 50%. And remember, remission is defined as the person would no longer be classified as having anxiety. So CBT actually outperforms pharmaceutical approaches, but still only provides a 50-50 chance of achieving remission. I believe we can improve the 50-50 success rate in our favour by first changing the wiring and structures in our brain with the phase 1 treatments. By the time you come to do the CBT therapy, not only should your anxiety be significantly diminished, but there's another effect of doing meditation brain training, which is that brain scans have shown meditation increases the number of connections running from the frontal lobes of the brain back down to the amygdala. This gives us more of what are called top-down control, top from the conscious parts of the brain down to the subconscious parts of the brain, like the amygdala. As far as I know, meditation is the only way to increase the number of top-down connections. Now again, I can't prove this, but from everything I understand about how brains work and brains and therapies work together, growing more of the connections that run from the thinking cognitive parts of the brain to the amygdala should enhance the effectiveness of the cognitive aspects of cognitive behavioral therapy. In terms of numbers, it's average to have 10 to 15 sessions of CBT, sometimes 20. But remember, you're entering into the CBT in an already improved condition. Now, once you've completed that, your anxiety should be significantly diminished, and your brain should be really optimized for the final treatment I recommend, which is called exposure therapy desensitization, also known as systematic desensitization. Again, I know that some of you don't like the idea of exposure therapy, but give me a minute to explain. This is where I'm going to talk about the new exciting anti-anxiety treatment. Now, the exact percentage of people who experience total cure from anxiety using exposure therapy desensitization varies tremendously according to the type of anxiety. But the percentage of people that experience some significant improvements is as high as 90%. If you haven't heard of exposure therapy before, it involves showing the amygdala and hippocampus that something they think is dangerous is not dangerous. It involves exposing yourself to or confronting the thing that you're afraid of in a safe clinical environment. Even if you don't have a specific phobia or trigger, you can still do exposure therapy desensitization by working with a practitioner like an NLP therapist who can show you how to briefly intensify the feelings of anxiety. If you remember, I said before, you can't tell the amygdala not to be afraid of something. It only learns by experience. When the amygdala sees that you can be exposed or in contact with the thing or the situation, and actually nothing bad happens to you, it changes its mind. You can reprogram it. We can rewrite the software programming, so to speak, that's running the amygdala and hippocampus. In my case, there was programming installed in my amygdala and hippocampus with the instructions: if you speak in front of a group of people, initiate a full-blown fight or flight response. From when I decided to tackle this problem, it took me 2.5 years of painful experimenting with different techniques to overcome my anxiety disorder. Today I know how to produce better results in half the time it took me. The sequence of treatments I proposed in this video is what I would do if I had my time over again. Some people have commented about my videos that they get lost in the details, so let me give you a kind of simple summary of the whole thing. I recommend you start your recovery with a combination of meditation brain training exercises, lithium orotate, Zembrin, and other background supplements as well. You need omega-3 to build the brain and make synaptic connections. You need to seed your colon with the right bacteria and then cultivate these bacteria with a high fibre, high polyphenol diet. You need good sleep because that's when most neuroplastic change occurs, and that might actually require additional treatment. If you're interested, I wrote a book called Sleep Better with Natural Therapies. I also recommend including a stack of supplements to boost neuroplasticity in general to enhance the synaptic remodeling that the meditation exercises stimulate. I also recommend putting together pre-meditation stacks of supplements to assist entering into a calm state before the meditation. You must also choose the right type of meditation to achieve the goals you want. One way of thinking about which meditation to choose is, in anxiety, parts of the brain are hyperactive, so we want to choose calming and sedating meditations. In depression, the opposite is true. Large regions of the brain are underactive and underfunctioning, so we want to choose meditations with stimulating effects. After 6 and ideally 9 months of doing phase 1, you move on to CBT therapy, before finally moving on to hopefully finishing off the anxiety condition with the new exciting way of doing exposure therapy desensitization, which I promised you at the end. I hope you're finding all of this information useful and you can have a go by yourself, but if you would like my professional help in putting together a treatment program, then you can book a one-to-one consultation with me online. We would spend an hour and a half to 2 hours together. You'd get a detailed prescription of supplements, dietary advice, which brain training exercises would be the most appropriate for you to start with, and a lesson on how to do those exercises. In terms of follow-up appointments, some of my patients want frequent coaching sessions, perhaps monthly, but if you're self-motivated or want a more budget-friendly option, we would only need a follow-up every 3 months or so when you've completed one of the 50-hour meditation brain training exercises. If that interests you, you can book an online appointment at calendly.com/PeterSmithUK. Pick a time, go through the payment process, and I really look forward to meeting some of you there. Finally, as promised, let me tell you about the new, very exciting treatment approach to enhance the effectiveness of exposure therapy desensitization. When you first hear about exposure therapy, it sounds like counterintuitive. It sounds like it wouldn't work. You think, surely, if I expose myself to the things that I'm afraid of, it's actually just going to create trauma and strengthen the problem. Well, it turns out that there's a right way to expose yourself to the things you're afraid of, whereby you stay in contact and don't turn away until the fear response has subsided. You're giving the amygdala time to learn that it can be in contact with this frightening situation and nothing bad happens to you. When properly done, exposure therapy can be highly effective. I definitely recommend learning how to do it with a therapist, but once you've done it with a therapist, you can actually do it by yourself. In fact, that's what I did to overcome my fear of public speaking. The new, I'm going to call it, enhanced way to do exposure therapy is after you've done the exposure during the day, you take a single dose of a beta blocker before going to sleep. Or in my practice, I would actually use a combination of calming anti-anxiety herbs instead of the beta blocker. It may sound strange or unexpected, but we don't actually learn or program new experiences into our amygdala and hippocampus, into long-term memories and associations at the time we have the experience. When we have an experience, the neurons involved sort of get tagged and then they change and develop themselves later on that night when we sleep. So we actually develop memories and new associations of the experiences we had in the day during the night when we dream. And the state of stress we are in at the time when we are dreaming about the experiences is what gets stored into the memories and programming. Let me say that again because it's a bit surprising. We form long-term memories and program associations into our amygdala and hippocampus mainly when we sleep and dream, not at the time when we have the experience. If you've had a stressful, even traumatic experience in the day, but when you are dreaming about it later on, you are in a calm and relaxed state during the dream. The calm and relaxed state is what gets associated in your memory banks. Understanding this is a breakthrough. It's opened up an amazing new treatment option. By taking something that artificially induces a calm and relaxed state when we dream, it seems to dramatically increase the effectiveness of the exposure therapy desensitization. Sorry, I should have explained something. Beta blocker drugs slow the heart rate, they relax the nervous system. They basically prevent you from going into a fight or flight or stress response. Because my practice is drug-free, instead of using beta blockers, I would use anti-anxiety herbs or a stack of anti-anxiety herbs. If you have access, there's a British television channel called Channel 4 that did a documentary series on a clinic in Holland called the Fear Clinic. I think that was the name of the documentary series, where they were using this technique of exposure therapy during the day and then a beta blocker. It's well worth a watch. So there you have it. These are the techniques I use in my practice to help people overcome anxiety. It's funny, with the benefit of hindsight, it doesn't look like much and it all seems very obvious, but I actually spent about 15 years working this out. I want to end by saying I believe anxiety disorders are very treatable. And remember, if you're hearing a voice in your head saying, oh no, this probably isn't going to work for me, or maybe something will go wrong with the techniques and it'll harm me in some way, you do know that's the anxiety talking, don't you? Especially if you've got health anxiety. Anxiety disorders can be one of the most distressing conditions to live with. I wish you every success with your recovery. Whether you choose to do it by yourself or with somebody else or work with me, I'd love to meet some of you in my practice. Don't lose hope. Don't give up and quit trying new things. Let me know how you get on in the comments. Bye for now.